Assalamu alaikum. My name is Hifsa Mariam. I am from MS Biosciences at the University of Wa. Today I'm here to present my research topic that was prevalence of hyperprolactinemia and its association with infertility in females of district Chakwal, which was done under the supervision of Dr. Razia Bibi. The table of contents are introduction, objectives, methodology, results, conclusion, future perspectives, and references. Here's the introduction. Hyperprolactinemia basically is an endocrine disorder. It is because of the high prolactin level in the blood that secrete from the interior pituitary, which negatively affects the female fertility and female reproductive function. Basically, because of the increased prolactin level, which disturbs the hypothalamic pituitary gonadal axis by suppressing the GnRH, and which leads to the less production of luteinizing hormone and follicle stimulating hormone. These all of the hormonal imbalances which results in anovulation, infertility, and amenorrhea, with causes that may be pathological, that may be drug induced, that may be physiological. Hyperprolactinemia, also report with the hypothyroidism. Hyperprolactinemia interferes with the follicular development and luteal body function, which decreases the progesterone synthesis. Infertility. Basically, infertility is the inability to conceive even after the 12 months of regular sexual activity. There are two types of infertility: secondary infertility and primary infertility. Primary infertility, the females who never conceived, and secondary infertility, the females who are unable to conceive even after a previous pregnancy. Objectives: to assess the prevalence and its factors of hyperprolactinemia in infertile women, to investigate the correlation of hyperprolactinemia with female infertility. Methodology: basically all the data that was done, demographic and the clinical data. So this data was obtained through the questionnaire study population. This study was carried out in the district Chakwal, in the district headquarter hospital Chakwal, and the private clinics. And the eligible patients were enrolled after the informed consent, and relevant data were collected using the structured questionnaires. Inclusion criteria: women in the age range of 18 to 45 and diagnosed with the primary infertility. Exclusion criteria: postmenopausal women and the prolactin levels may be impacted by their antipsychotic drug use in women. Sample size calculation: basically prevalence based sampling method was used to calculate the sample size. By using this formula, the sample size was 325. Sampling method: purposive sampling was used in this investigation. Purposive sampling is one type of sampling intentionally selecting the participant based on their specific criteria, and the purposive sampling is the process carefully selecting those selective sample members based on their researcher understanding of the population. Data collection tool: questionnaire designed in English. Socio-demographic variables like their age, their BMI, their diet pattern, their stress level, reproductive history, their menstrual cycle history, hyperprolactinemia symptoms like amenorrhea, oligomenorrhea, galactorrhea, hormonal, lifestyle, and family history. Hormonal, their level of follicle stimulating hormone, their level of prolactin, and the level of the luteinizing hormone. And the lifestyle factors like their diet pattern, their stress level, and their sleep pattern. Statistical analysis: the statistical data analysis was performed using the software SPSS 20, and the chi-square test and independent t-test was performed. Results: these are the results. These are all the different risk factors that influence the female who were diagnosed with the hyperprolactinemia or infertility, like the age of patients, their body mass index, their diet type, their sleep pattern, their stress level, their weight gain, hypothyroidism level, the history of PCOS, regulation of menstrual cycle, galactorrhea, amenorrhea, and oligomenorrhea. These all are the frequency bar charts that shows the different ranges of the female patients who influence by the hyperprolactinemia or infertility. These are the cross-tabulation charts, stress versus hyperprolactinemia. This bar chart shows that those patients who suffer from hyperprolactinemia had more stress level, like comparison with the normal prolactin group, who had the stress level less common than the hyperprolactinemia patients. And this finding suggests that hyperprolactinemia and stress is totally related in the patients of district Chakwal. PCOS versus hyperprolactinemia. This bar chart shows that hyperprolactinemia patients had more suffered from the hyper PCOS as comparison with the normal prolactin level. So these findings suggest that hyperprolactinemia and PCOS were closely related. Menstrual cycle versus hyperprolactinemia. Menstrual cycle irregularity was more common in hyperprolactinemic patients, and this bar chart also shows that hyperprolactinemia was menstrual cycle irregularity was more common in the hyperprolactinemia patients, and this finding suggests that hyperprolactinemia and menstrual cycle was also closely related. Chi-square test. This test suggests that there is a strong association between the two variables like hyperprolactinemia and infertility, and the p-value is less than 0.05. So this finding suggests that there is a significant association between these two variables. Conclusion. The study shows that hyperprolactinemia is relatively prevalent among females in district Chakwal associated with infertility, and infertile women showed a high frequency of elevated prolactin level, like their stress level, like their menstrual cycle irregularity, and PCOS history. These all findings suggest the role of hyperprolactinemia as an important endocrine factor in female infertility. Future perspective. Future research should include larger longitudinal studies to clarify the relationship between these two variables like hyperprolactinemia and female infertility, and evaluating treatment outcomes and community-based screening programs improve their early diagnosis and fertility management in this population. Acknowledgement, Dr. Razia Bibi, Supervisor, Department of Biosciences, and members of GEC. References. These are all the references. And thank you.